Union County. Jennifer Thrush here from the Union County Health Department, and I'm coming to you today from a Zoom meeting. I've got to be honest, I am not a regular Zoomer, so this is a new experience for me here. We have with us today Renee Chung, who's a PhD here. She's a psychologist and actually a counselor at the Lower Lights Christian Health Center here in Marysville. And Dr. Chung is also the Chief Clinical Officer for our Union County Mental Health and Recovery Board. So we've asked her to Zoom with us today and talk a little bit about the mental health component of this pandemic and how we're dealing with that and give us some tips. So welcome, Dr. Chung.
Hello, Jennifer. It's good to be here. Thank you for having me.
Well, thank you for joining us and taking the time today. I'd like to get started just a little bit with for our viewers at home. What are some of the questions that you're getting from your patients?
Yeah, so some of the questions that I'm getting right now is kind of this, how do we deal with this pandemic? They feel like it came on all of a sudden and just struggling to make meaning and sense out of this pandemic, and how do they adjust to some a lot of people have lost their jobs, so how do they adjust to staying home? And as well as now that they're home, they are having increased anxiety and depression symptoms, and so they're feeling a bit overwhelmed. So they want to try to make sense of it, try to grasp this, and try to figure out what is the way that I can cope so that I can make good sense and try to move forward in this unprecedented pandemic hour that we're having.
So Dr. Chung, what are some of the tools that you would encourage folks at home or when you're with your patients? What are some of the tools that you're using to help us all cope with this kind of this sense of a Groundhog Day, a little bit of our loss of routine and like you said, this little bit of loss of control? What are some of the tips that you're recommending?
Yeah, so if people have increased anxiety and depression, I definitely do recommend connecting with their family and friends. And of course, we cannot connect through our face-to-face because of our stay-at-home order. So what I encourage them is to use healthy coping. So some of the healthy coping is to connect by others through phone, through text messaging, through video chats, and other social media. Luckily, a lot of people are connected through our wonderful technology. So I'm asking people, please use healthy coping. And even though it's social distancing, it is not by means social isolation. So to connect and make sure that they get proper amount of sleep and light exercise, and to spend time with family to support each other.
And when we're making these connections with our friends or loved ones, like I as we were chatting, a little good tip you had said, this doesn't have to be a super long conversation, right? But maybe more frequent touch base?
Yes, yes. So we can send some e-cards, a happy cheer, or a smiley face on the text, just to say, hey, I'm checking on you. I'm thinking about you. Have a blessed day. Have a wonderful day. And that could really brighten someone's day. And it's just really saying, I got your back and we're in this together and we can get through this.
And I can relate with that completely. Shauna Sue, our communication specialist there, she has an awesome rooster on her family farm. And sometimes she'll just send me a little audio clip of the rooster giving the wake up call. And, that's just enough to be like, today we're going to make it through this day.
Yes, yes. And it's important to make sure that they practice that healthy coping and to avoid unhealthy coping, such as drugs or alcohol or any destructive behavior right now, because we are going through opiate crisis as well. So I just want to emphasize that we don't need to, be overwhelmed and default to negative coping, but there is positive coping there, and it is within our control and our goodwill to practice that.
Awesome. And there's also this sense, at least we hear sometimes, even in the office, of a Groundhog Day. Every day seems to be a little bit of the same. And if I have little ones at home, and sometimes my poor husband, he's, staying home all 14 or so hours a day with them now.
Yeah.
What are some tips for kind of dealing with that sense of a Groundhog Day?
Yes, yes. So with families, it's good to keep the schedule for the kids who might be home for school. So keep them home and do, keep a routine on their homework, do some fun projects. But I really do encourage families to still get out there in the warm sun and the weather out there, because we can still do that while we're still practicing good social distancing. So it's good to break up those times in our day and go for a walk or take a drive to the park and, enjoy the fresh air and smell the flowers. Those still are definitely encouraged during this pandemic period. And to create those wonderful family moments still. Those are very important.
Exactly. And I like something that you had said too about how we are trying to reframe some of our thoughts and the meaning behind this. So I like that focus maybe of shifting what is very stressful to how could we think about that as, an opportunity to have a positive interaction with our kids or our parents or loved ones.
And kids will have some questions, so we can answer their questions in a developmental appropriate way. And as parents and caregivers, we can, let them know that, yes, this is a little bit change in routine, but everything will be fine. So giving that sense of security to our kids and vulnerable population is definitely good for their well-being as well.
Wonderful. Last question for you, Dr. Chung, is what are some of the resources available, or where might you direct someone who's watching this right now? Where could they reach out to talk about this important piece of their health?
Sure, yeah. So if someone feels ongoing mental distress or psychological distress, they can reach out to their local mental health agencies and connect with them. Luckily, we are able to do telehealth by video right now, so most of the assessments still should be available. And so please contact your local mental health agencies, and we would be definitely happy to help you and get you started. So do not hesitate to do that during this time.
That's great advice. And luckily, folks at home, if you're not as familiar, here in Union County, we have a lot of great resources for mental health here in our community. We have a wonderful mental health and recovery board who's working with a number of partners. We'll make sure that in the comments below here that we're going to list some of those resources, especially the texts and call lines that you can reach out to. So Dr. Chung's given us great tips, but we'll also have those resources in the comments below. Also, Dr. Chung hit on our vulnerable populations. That might, someone that maybe is in the process of recovery and has been doing a great job, but the stress of this new situation is kind of hitting them. We'll make sure we also have in the comments some of those resources we have available to those folks as well. So
yes,
Dr. Chung, thank you so much. Is there anything else that you think is important for us to know as your listeners out there?
Yeah. I just want everyone to just thank everyone, even all the healthcare workers and our nurses and all the doctors and everyone that's out there providing all sorts of one-to-one, face-to-face care and just, spilling their heart out there. So for everyone out there, we are with you and our hearts are with you, and take good care. And we definitely will get through this with all these awesome support that we have in our community. So thank you.
Thank you, Dr. Chung. It's made me feel a little bit better just hearing your voice and your perspective. So we appreciate your time today. Thanks for joining us.
Thank you very much for having me. Take good care.